Assalamualaikum, my name is Nur Ali Afina binti Abdul Khalil.
My name is Nur Anis Fazana binti Fauzi.
Today we are going to have oral assessment.
The task begin with candidate A first, while candidate B listen. Candidate A is given a picture showing a doctor and nurses handling an influenza outbreak. She will describe what she see in the picture. You will be given 1 minute to prepare. You may start now.
In this picture, it talk about the influenza outbreak that already spread worldwide. I also see the influenza outbreak banners at the hospital walls, and I saw a doctor, one of the doctor who's standing in the middle of the hospital. He looks intense and worried because the patient who got infected with the influenza virus has increased, because the hospital staff wearing masks and also gloves so that they can protect themselves from the influenza virus. On the left pictures, I see the patient lying on the hospital bed. In the hospital bed, he seems so weak and sick, and the nurse was helping him to use the IV drip. On the right image, I saw the patient covering his face with a tissue, and the nurse also helping him. That's it. Let us continue with candidate B while candidate A listen. Candidate B is given a picture showing the same picture. She will describe what she sees in the picture. You have 1 minute to prepare. You may start now.
In what I see in this picture, from my point of view, in this picture I can see a doctor standing in the middle of the room. He is wearing a lab coat, blue glove and a mask on his face. The doctor looks very serious and worried. Maybe because the situation is difficult to control. The doctor also seems to be thinking about the next step or what treatment he will give. Other than that, in this picture, what I see is behind him there are several nurses who are busy to help the patient. For example, one nurse is standing beside a patient who are very weak and pale. The patient is laying on the bed, on the hospital bed, maybe because he has a fever, the high fever or problem breathing. Other than that, on the wall there is a big sign, a big red sign, is influenza outbreak. This shows that the hospital is facing a very dangerous situation and a very dangerous crisis.
That's it?
That's it.
Okay. Anif, why the doctor looks so intense in this picture?
The doctor looks very intense in this picture because the situation in the hospital is very busy and have a lot of patients.
Yeah, I agree with you, because you will say that the influenza virus is very dangerous to us and it also can cause death. So that's why the staff and the hospital staff and doctors look intense and stressed.
I would like to ask you the question too. What is the most difficult challenge that facing by medical staff during the influenza outbreak?
The most difficult challenge that facing by the medical staff during the influenza outbreak is they have to facing with the the most dangerous virus, which is influenza, because influenza is one of the virus that can cause death to us, because influenza also same like the COVID-19 virus, which is it can spread by touch and the air, and the symptom also almost same like the flu, cough and fever, and also they have to, and also the hospital staff also need to work extra time, because the patient who got infected by the influenza has increased the lack of staff, so they need to work extra time. And do you agree with me?
Yes, I agree with you.
Can we make the conclusion about this influenza?
Yes.
Okay. In conclusion, influenza virus are very dangerous because it can cause death. Besides, it also makes us suffer with the complications such as pneumonia, and also can worsening the chronic disease like asthma and also the heart disease, because the virus is focused to spread in our lung.
Overall, the picture reminds us to appreciate the effort and bravery of medical workers. They are a real hero in any situation of outbreak and pandemic. That's
all from us. Thank you.
Thank you.